an 8-year-old child is brought to the emergency department because of profuse diarrhea and vomiting for the past 2 days. The boy was born at 39 weeks gestation via spontaneous vaginal delivery. He is up to date on all vaccines and is meeting all developmental milestones. Past medical history is non-contributory. The family recently made a trip to India to visit the relatives. Today his heart rate is 100, respiratory rate is 22, blood pressure is 105/65, and temperature is 99 degree Fahrenheit. On physical examination, he appears unwell with poor skin turgor and dry oral mucosa. His heart has a regular rate and rhythm, and his lungs are clear to auscultation bilaterally. His abdomen is sensitive to shallow and deep palpation. A gross examination of the stool reveals rice water appearance. Diagnostic microbiology is pending. What is the next best step in management? I think the last line gives a lot of information. So we have rice water stools, and they just want to know the next step. So this is cholera, and if someone couldn't come to it, maybe you could just go through the entire question if you didn't get it from the rice water stools. So they're usually giving you a history of a child who has profuse diarrhea and vomiting, all right, and then they give a history of trip to India or something. Some of the developing countries or something, they'll give a history like that. They had a recent travel history to there, and then after that they can give you history of dehydration like poor skin turgor and dry oral mucosa. Okay, and then naturally the rice water stool appearance. All right, so always remember the first and foremost treatment for cholera is aggressive fluid resuscitation. All right. So you can do it either by ORS, that is the oral rehydration solution, or you can do it by the IV fluids. It depends on the amount level of dehydration, which is not very important for your step one. But to give you a brief idea, so mild, and you have mild, moderate, and severe dehydration. So if I'll talk about the question presentation, so if it is severe form of dehydration, they will usually mention the patient has sunken fontanelle, loss of consciousness, or extremely dehydrated, dry skin, something like that. And if it is mild, they will just write poor skin turgor or dry oral mucosa with normal vital signs. All right. So that is for mild. So when you have mild or moderate kind of dehydration, you usually go for ORS, and when you have severe, you prefer IV fluids. But the main thing is you always go for aggressive fluid management and not for antibiotics or any other nutrition supplements. So many of you must be wondering that in diarrhea, we like in pediatrics and all, they must have mentioned that you use zinc supplementation and vitamin A or nutrients. So these are all secondary modes of treatment. You have to first take care of the dehydration, which requires the fluid, because the major cause of death for patients with cholera is hypovolemic shock, right?
Thanks for watching. Please give a thumbs up and subscribe for more.